Having talked about what it means to rotate about an axis of motion, we can now start thinking about how the particular joints of the human body rotate, and how in many cases we can think of those as rotations in a plane, in fact, in one of the primary planes of movement of the body. So to get into that, I want to go through first the fundamental motions that we see at joints. And like last week when you had those pairs of anterior and posterior and medial and lateral, we'll have pairs of movement that work together to describe the motions of a particular joint. So I'm just going to list out those terms right now, and then we'll go in detail on what each of them means. So first off, the first set of terms I want to talk about is flexion and extension. Then I want to talk about abduction and adduction. Notice the D versus the B. Sometimes you'll hear people explicitly say abduction versus adduction to really differentiate these two, because if you're talking quickly, it can be hard to hear which one somebody is saying. Then I want to talk about internal and external rotation. I want to talk about pronation and supination. And then lastly, I want to go in detail on what happens at the wrist, because it's a little unusual because of the versatility of the wrist joint. But let's talk about the big ones first. So, flexion and extension, these are rotations in the sagittal plane. At least when we've got the body in the anatomic configuration. So let's think about maybe the knee joint. Knee joint right here, right, it's got this axis of rotation, and that's going to be equivalent. Talking about this axis of rotation is equivalent to talking about rotations in a plane that is perpendicular to it, meaning the sagittal plane. So flexion, that means maybe the best way to think about it is, well, it's like bending your knee, but maybe we could write making the angle smaller. Sort of a colloquial definition, but bending the knee to decrease the size of this angle, that's what flexion is. And then extension is just the opposite. That's also true at other joints. Say we can flex and extend the elbow joint. Flexion of the elbow joint would be like this, right? It would be making that angle smaller, and then extension is just the other way. You can flex and extend the hip, you can flex and extend, say, at the low back, and all those are rotations in the sagittal plane. Let me show you what that looks like over in OpenSim here. You'll notice that I can go down and grab the right knee and flex it and extend it. One thing we'll talk about in a few weeks that is maybe just relevant to notice here is that as I flex the knee, notice how the muscles are actually wrapping around the knee joint. So that change in the length of the muscles is something that will become relevant later in this course. You may notice, I don't know how clearly you can see the names of all the motions up here, but this one is actually labeled hip flexion and hip extension. So hip flexion, I'm like making the angle between the thigh and the torso smaller when I do this. And then extension, I'm making that angle bigger. Quite often we'll have muscle groups whose names come from the motions they induce. So you may be familiar with these muscles right here, this group of muscles known as the hip flexors, because when they contract, they flex the hip joint. So that's flexion and extension. How about abduction and adduction? Well, these are going to be rotations in the frontal plane. Quite often we'll talk about this at the hip because the hip is, quite able to move in this plane. So let me clear away this. Abduction and adduction. So let's just draw ourselves a little frontal plane here. So if we abduct the hip, maybe the best way to think about abduction is away from the center line of the body. So that would be like moving the hip out like this, or here, or here, or here. And then adduction is the opposite, more towards the center line of the body. So that would be like letting the leg cross over like this. Okay, let's take a look at that over here in OpenSim. I can grab the handle that says hip adduction, and I can crank that out. I can abduct. Right now I'm abducting the hip, moving it away from the center line of the body. And then I can bring it back by adducting the hip and even let it cross over like this. So abduction, adduction. Rotation in the frontal plane. Then internal and external rotation. That is going to be rotation in the transverse plane. So again, the hip a good example because it's free to move in all these planes of motion. What is a rotation in the transverse plane going to look like? Well, that would be like maybe turning the foot so that foot points in like this by spinning the whole leg this way. Be like internally rotating. The name is in this case quite easy to remember. Internal means rotating in, rotating inward, and then external rotation just means rotating out. Again, I can show you that over here in OpenSim. We can go down and we can grab hip rotation. We can rotate the hip internally like this. We can rotate the hip externally like that. Now, the hip is a great example for all of this because it's free to move in so many different directions. You do get small amounts of internal and external rotation at various points in the body, even at the knee joint, for example, which we'll talk about in a further video when we talk about simple versus complex ways of thinking about a joint. Lastly, pronation and supination are a little bit weird because these are not, let's say, not in a classic traditional plane of motion. Now there's two places where you see pronation and supination used. You see it at the foot, or more specifically at the subtalar joint. And you see it at the wrist as well. So let's, I think I have a picture up. Yeah, here we go. Here. So pronation is a rotation at the subtalar joint, which is kind of like a weird, it's like an axis of rotation that kind of comes out at the back of the heel and then continues on the other side of the foot. So pronating is like involves a rotation about that joint axis. It's probably more clear if I show it to you here. So let's pronate and supinate, and technically, so there's one of the funny things is at the subtalar joint, people use interchangeably pronation, supination, and another set of terms which is inversion, eversion. Let me make sure I get them correctly. So eversion is semi-equivalent to pronation. Inversion, sort of, kind of, not really equivalent to supination. I'm not going to drill you on the specifics of differentiating these because it's some kind of technical biomechanics and anatomy stuff. But what I do want you to notice is, and we talked about this briefly last week, let me grab the left foot's subtalar angle, subtalar joint angle. And you will notice as maybe it would be helpful if I showed it to you. As I rotate it, this is not a rotation that's happening in any of the three planes of motion. It's a rotation that's happening offset from that. So the subtalar joint is weird, and we will talk in detail later about precisely how and why it's weird. But the other place you see pronation and supination that's less weird is at the wrist joint, right here. So in the anatomic position, which is what we're looking at right now, with the palms facing out, the palms facing forward, the thumb facing out, this is the wrist in a supinated position. So let's make a note down here. At the wrist, supinated equals palms forward. And pronated means palms backwards, like flipping the hand back around. And let me show you that again. I think this model has enough degrees of freedom to do this. So let's go down to the left arm and grab the wrist, and let's, here we go. Okay, so notice this is supination, and let's pronate the wrist by rotating inwards. So this is moving in pronation, this is moving in supination. Now I told you things were going to be funny at the wrist, and there's one more set of wrist-specific motions that you should be familiar with. I don't think we'll use these that often. Lucky for you, I am not a really big specialist on upper body biomechanics. But let's, for the sake of completeness, wrist. Let's talk about ulnar and radial deviation. Now, like the hip joint, the wrist is a highly mobile joint. So what I'm talking about with this is I'm going to be talking about rotations in a plane like this. So the axis of rotation is going to be coming off like that. So this is like tilting the hand over like this or over like this. It's like waving to somebody. So let's look at it. Oh, I did not show you. Let's see. Let me switch back to the blackboard. So what we're talking about here is at the wrist, ulnar deviation, radial deviation. So, as I was saying a moment ago, that's rotation in a plane like this, meaning equivalently rotation about an axis of rotation like that. So it's like waving to somebody, tilting your wrist like this, tilting your wrist like this. You open back up OpenSim and show you what I mean. So let's see if I can find, here we go. Okay, so first of all, we need to know which of these bones is the radius and which is the ulna. Hopefully you remember the bottom one, the one that you would like karate chop a cinder block with. That's the ulna. In fact, you can see when I select it, it goes down to the ulna. So ulnar deviation means kind of tilting the wrist towards the ulna. So that'd be like that, going towards the ulna, and then radial would be towards the radius. That's this one right here. Okay, so I want you to have heard of those and know what they mean. That's maybe less important than knowing these big three, and then being reasonably familiar with pronation, supination, and their semi-quasi not quite equivalents, eversion, inversion. Again, that specifically being for the subtalar joint, foot, and then at the wrist we have this special pronation, supination, and ulnar and radial deviation. Okay, so that was a lot, but hopefully some of this at least is review, and then we can go on to talking about how we think about these joints in motion. So I'll see you in the next video.